Hi, my name is Kayla Dermick, and today I'll be presenting about common injuries in soccer athletes. We will first talk about the benefits of playing soccer, including why it is important to work on cardiovascular endurance, strength train, work on agility drills, and technical practice. I will then talk about the most common injuries with soccer players, the protective equipment that athletes use to reduce the risk of getting injured, how different training, coaching, and techniques are used to reduce the risk of getting injured, an example of what athletes do to prevent getting injured, and a recommendation of how this sport can be improved to prevent injuries. The benefits of soccer involves a lot of running and sprinting, which can strengthen the heart and lungs, lower blood pressure, reduce the risk of heart disease, obesity, diabetes, and hypertension. It also builds and maintains strong muscles and bones, reduces the risk of osteoporosis, aids in weight loss, strengthens the immune system, reduces stress and anxiety levels, and improves sleep. The quadriceps, hamstrings, glutes, calves, groin, hip flexors, and Achilles tendon are used to kick, run, and are used for stability and agility. Upper body muscles include the triceps, biceps, and shoulders that are used for balance and stability for each player. The shoulders and chest are used for throw-ins. Common injuries of soccer athletes. According to a study published by Andrew Tucker at the University of Maryland Medical Center, it was found that as soccer athletes age, the risk of getting injured increases. In a study that focused on the injuries of a major soccer league over 6 years, it was found that out of 9,713 injuries, 12.3% were hamstring strains, 8.5% were muscle strains, and 7.6% were adductor strains. Muscle strains mainly occur with the adductors, quadriceps, or hamstrings. Concussions occur from getting hit in the head or neck. The study reported 310 cases of concussions. Concussions can cause headaches, visual changes, nausea, dizziness, and difficulty with concentration. It is extremely important to get medically examined and properly recover after getting hit in the head, as concussions can lead to fatal brain damage. Contusions, also known as bruises, occur when a player gets hit with an opponent's foot, knee, or elbow, causing pain, swelling, and a decrease of muscle function. It is common for soccer players to get groin pain, which is caused by the musculotendinous strain of the adductor group. Epiphysis, which is known as inflammation, commonly occur in the adductor, hamstring, hip flexor, and sartorius attachments. Shin splints, also known as tibial stress syndrome, can be caused by constant stops or changes in direction when running, causing inflammation on the tibia bone. Sudden changes in movement and direction cause a tear or pop of the anterior cruciate ligament, also known as the ACL. A posterior cruciate ligament, the PCL, can occur when getting hit in the anterior tibia or falling onto the knee. The anterior talofibular and calcaneal fibular ligaments of the ankle can be torn, and the medial or deltoid ligament in the ankle can be sprained due to running, kicking, or landing from jumps. Shin guards can be worn around the lower leg to absorb shock and prevent contusions, abrasions, or fractures if kicked in the tibial bone. The straps on the shin guards should be tightened to ensure they do not move on the leg and provide protection for the lower leg. Mouth guards are important to protect your teeth if you get hit in the head. For men or boys, athletic cups can be worn to protect the groin area from getting injured. For goalies, it is important to wear goalkeeper gloves, as they not only protect your hands from injury, but also provide grip when catching a ball. Goalies can also wear long sleeve shirts, as it aids in protecting the skin when diving for the ball. Proper cleats are important for stability, traction, movement, prevents falling, and provides support for your feet and ankles. Strength training increases jumping movements, speed acceleration, builds muscle, and reduces the risk of injury. Important exercises include squats, deadlifts, lunges, planks, hanging leg raises, push-ups, bench press, jump squats, and box jumps. High-intensity resistance training, such as sprint intervals or plyometrics, can improve aerobic endurance, strength, and speed. Proper warming up and cooling down is crucial for preventing injury. Stretching is necessary to prepare the muscles for exercise, improve range of motion, and increase flexibility. Proper diet is crucial for energy and muscular recovery. Water intake is necessary for oxygen flow throughout the body and transporting nutrients. Proper education and coaching is important to ensure proper conditioning and exercises are being performed correctly. If a player gets injured, a coach should know how to respond. Coaches also act as role model for athletes, which can influence a soccer player's motivation and performance. They ensure the players are being safe. Athletes can perform the FIFA 11 Plus to prevent injury, especially in females between the ages of 13 to 18 who have a high risk of knee and ACL injury. It consists of an 8-minute duration of slow speed running exercises, 10 minutes of strength, plyometrics, and balance exercises, and 2 minutes of high speed running exercises. This program improves neuromuscular control, jumping and agility skills, coordination, and reduces risk of injury. One area of improvement for soccer athletes is to create an exercise plan that can benefit their training. It is important for soccer athletes to improve strength, endurance, agility, and flexibility. An example of this can be to work on speed, agility, strength training on Monday and Friday, work on speed, plyometrics, and strength training on Wednesday, working on tempo and conditioning on Tuesday and Thursday, and taking Saturday and Sunday as rest days. Rest days are crucial for giving time for muscles to repair and recover and avoid burnout. Thank you for listening to this presentation, and these are my references.